Well, it is time now for our Doctor is In segment. And today we are talking about vein problems in your legs. Joining us now is Dr. Rodney Sirk with the Fairhope Vein Treatment Center. Dr. Sirk, thanks so much for being our guest today.
Thank you. I'm very happy to be here.
How common are vein problems in people's legs?
They're very common, at least 40% in male and female. Some studies even showing higher.
Wow. And so what are symptoms? How do people know, other than maybe the way the vein looks, if they're having these problems?
Yeah, sometimes it's very obvious. You look down, there's a huge vein on your leg. I mean, obviously you have a vein problem. But other times it's much more subtle. Just leg swelling, pain, restless legs. Sometimes advanced disease, skin ulcers, or just skin discoloration, and it's not so obvious.
And this can be obviously a very life-threatening problem sometimes. So if you're not sure if it's a vein or something else, obviously you need to get it checked out.
Absolutely, and really the only 100% way is to see someone, a vein specialist, and have an ultrasound where you can actually see the veins and examine them.
What can you do about veins that bulge? We've been showing some photographs, and they look really bumpy on someone's leg.
Well, interesting enough, the veins you see are just an outward. The bigger problem is usually a deeper problem needs looked at. Lots of different treatment options, but depending on which veins involved and what needs to be done.
So you start out by, of course, diagnosing the problem, and that's by using an ultrasound?
Yes, that is absolutely the best method and the most accepted method for diagnosing a vein problem.
And are these procedures that you do to help people with their vein problems, are they surgical? Do they have to be put to sleep?
They do not. They're considered minimally invasive procedures. That has changed so much, and that's why we're trying to get the word out. You know, it doesn't involve the hospital or surgery or stitches or anything anymore. It's all done. Something can be done in the office while you're awake, and you can drive home afterwards and get on back to work or your daily.
Right, and we are going to be talking more about vein problems on Facebook Live, but a lot of people might be wondering, I have an unsightly vein, I want to get rid of it, a varicose vein or a spider vein. I guess it depends on the severity of the situation, whether insurance might cover that.
Yeah, a common question, but the basic principle of that is insurance will consider coverage if it actually bothering you. If it hurts or swells, you have a skin ulcer or a change, it's enough to disrupt work or your activities of daily living, your normal activities, then there's a good chance they'll pay for it.
All right, Dr. Rodney Sirk is our guest today from the Fairhope Vein Treatment Center. Again, he's joining us on Facebook Live at 12:30, and that's your opportunity to ask him any question that you might have, or maybe you could even send us a picture of your vein if you'd like to. Again, that's on Facebook Live at 12:30. Thanks so much, Dr. Sirk.
You're welcome.